A physical attack is easy to identify, but what about an attack on your body's energy? Seen from the perspective of traditional Chinese medicine, what we call depression has deeper roots in your body's energy flow. In this episode of Vital Signs, Dr. Jing-Dואan Yאנג, an American psychiatrist and doctor of traditional Chinese medicine, joined Brendan Fallon to discuss the link between the body's energy flow and mental and physical health.
For millennia, what we call depression and other mental distress have been seen by traditional Chinese medicine, aka TCM, as problems of energy flow interruption, and hence the use of systems like acupuncture to treat them through stimulating energy flow. As these methods gain scientific validation, we see them integrated more and more into Western medicine, with acupuncture even being used by the US Air Force for battlefield pain management. But what is the body's energy flow as understood by TCM? Does it overlap with the energy our cells produce from food? What would cause this energy flow to be disrupted to bring depression and mental distress? And what can be done energetically and even on a deeper emotional level to get things moving again? Today I welcome back Dr. Jing-Dואan Yאנג to lend his wisdom to these and other questions of energy and mental health. Dr. Yאנג is a psychiatrist and integrative medicine doctor who combines Western medicine and holistic medicine. He also represents the 5th generation of his family line to practice TCM. Welcome to Vital Signs, where we learn how to get healthier from all angles, from the biochemical and nutritional to the things we do that nourish our minds and our souls. I'm Brendan Fallon. Dr. Yאנג, fantastic to have you join us on Vital Signs again.
Thank you for having me, Brendan.
One of the main reasons I wanted to ask you on, Dr. Yאnг, is a comment you made about how important the energetic aspect is to our mental health. And I know you look at health from this 4-dimensional model of biochemical, structural, energetic, and spiritual. But for starters, I'm interested to know a snapshot of where the energetic aspect fits in to this 4-dimensional model that you have.
Thank you for the question. And if we really think about what depression is or what depression manifests, we can look at, decreased interests and have lack of the ability to feel the pleasure, and then the fatigue and the lack of concentration and change of appetite and trouble with sleep, and have some passive or active suicidal thoughts, and feeling shame and guilty and blaming self, and so on and so forth. If you look at all these symptoms, they are manifestation of problem with either thoughts or feelings or physical activities. And this is all really manifestation of energy. And the thoughts are energies, the feeling emotions are energies, and the physical behaviors and energy levels. So they're really a problem to begin with, is manifest as energetic level. So when we are facing energetic problems, we have to understand that from the energetic level. Of course, the modern medicine started, relatively new, and it started by understanding human anatomy and the body structure, which is great, which is important that we understand how the human body is made of and materialistically. And the second is about chemistry. So we began to understand a lot of nuance of the biochemical ingredients and the biochemical process and what involved in the biochemical balance. And that's where we understand that now the psychiatry almost like therapy-wise downgraded from understanding it from the spiritual and energetic level to the biochemical level. And now we prescribe a medication that disrupts the biochemical process to generate artificial effects to make people feel different, and which works for some people. But in the long run, the chronic use of biochemical intervention that is caused by energetic problems and even spiritual problems, and we're not going to give us long-term benefits.
It's kind of a Band-Aid solution for many people.
Yes, Band-Aid solution, and also it can cause new problems.
To see that full interview and others on how to optimize health, go to ept.ms/vital signs. Vital Signs offers general health information not intended as medical diagnosis or advice. Please consult your doctor before undertaking a new health regimen.